As dementia progresses, the person's cognitive and functional abilities decline. Often this results in the need for the person living with dementia to move to a place where they can receive specialised care, such as a dementia care unit. Relocating someone living with dementia away from their familiar environment can present significant emotional and psychological challenges. It is extremely wise to consider and explore future care needs early. Guilt and fear may prevent family members from entertaining this idea until it's too late. For many people, their journey to care begins with a medical emergency at home requiring hospitalisation. They may then bounce around the system before reaching their final destination, and some may never return to their former home. The situation can result in significant trauma and relocation stress, leaving both the person and their loved ones physically and mentally exhausted. People living with dementia benefit greatly from regular routines and familiar surroundings. Their homes provide a sense of security and comfort. When they're exposed to new people and places, they may experience increased confusion, disorientation, anxiety, agitation, depression, and behavioural disturbances. Involving the person in the decision-making process can help to reduce relocation stress for some people. For example, discussing the move, choosing a care home, and deciding when they will move. The problem is often that due to confusion and memory loss, they may later forget and may accuse the family of dumping them or abandoning them. If the person does not recall being involved in the decision-making and lacks insight about their need for care, they may demand to return to their home, and it may help to refer to their stay in terms that make it sound temporary. For example, saying, "We're staying here for now," or "staying for a while." This may be more acceptable and may provide opportunity for the person to become more comfortable and more settled in that environment. When selecting a care home, consider whether it will meet the person's individual needs. This may include the philosophy of care that the care home provide, staffing levels at different times of the day, options for private or shared accommodation, access to bathrooms or en-suites, independent access to outdoor areas, and opportunity for meaningful activities and social engagement. Careful consideration of these factors may reduce the potential for further need for relocating again. Adjusting to new people in a new place is challenging for anyone, but especially for someone living with dementia. It requires forming new relationships, building trust, and learning to find their way around a new environment. Whenever possible, introduce the person living with dementia to the new environment gradually. For example, attending a unit for meals or for social activities and having a period of respite in the lead up to an admission. This will help them to form relationships with staff, other residents, and to feel more comfortable in the environment before the big move. It also allows the family to get some idea of what's happening in that particular care home and whether they're happy with that standard of care. A move to care often results in lost independence and autonomy for the person living with dementia. Decisions about their daily routines and care are often made by others and are frequently based upon the needs of the organisation rather than the individual. Person-centred, relationship-based care requires staff to understand each individual and, wherever possible, promote choice. For example, a daily routine that reflects their past bathing habits and meals that reflect their food preferences. Separation from the usual social and support networks such as family, friends and neighbours can result in a sense of isolation and loneliness. The person is losing memories already due to dementia. These memories support their sense of who they are, and those close to the person help to support their sense of self and their sense of belonging when those memories are not available to them. Providing the care home with a detailed life story about the person can really help staff to engage the person in conversations about their life, which support a sense of self and feelings of value. Due to the confusion of dementia and memory impairment, the person may forget where they are and why they're there. Exposure to unfamiliar sounds, sights and routines of communal living heighten anxiety, and they may be frightened by the presentations of other residents at times. Staff are strangers who pass them by looking worried or busy, and the person with dementia can pick up on these non-verbal cues, misinterpret them as the person being angry. They may start to be worried about why they're there, what are they doing there, what's going on, and their anxiety can quickly escalate to panic. The person may start to bang on doors, demand to go home, or that their family be contacted. Some even demand the police be called, which is a fairly strong indicator of the state of terror they're experiencing at that time. When the person is asking to go home, what they need the most at that time is to have their feelings heard and acknowledged. The staff are encouraged to demonstrate empathy and validate the person's feelings, saying things like, "It must be so hard for you, you must really miss being at home," and asking them questions about their home. For example, what are you missing the most? Engaging the person in a conversation about their home, and then very gradually and with great care steering the conversation away from that topic and engaging them in a distracting activity. It's important not to change the subject abruptly, as they may realise that's your intent and that can build mistrust. Families are encouraged to bring in familiar items from home, such as photographs of people and places that are meaningful to the person, small items such as familiar pieces of furniture, a bookcase or a side table, a familiar chair, and soft furnishings with familiar colours, patterns that help the environment feel safe and homely. They can help the person better identify which room is theirs, but also gives them that sense of being at home. The transition from home to care is a difficult and emotional journey for family caregivers. Feelings of guilt, grief and loss are often prevalent. Inadequate support and communication during the transition can exacerbate feelings of abandonment and helplessness. Prioritise your self-care to prevent burnout. Reach out to support networks, including dementia support groups, counsellors and health professionals for support and guidance.